tribute to the healthcare workers in my constituency, but also across the entire country. And it is actually great to see today that news that we're looking at another 6,000 more doctors, another 12,000 more nurses in the NHS, and move towards what we'd like to see in the future. I'd also like to pick up on the comments of my honourable friend, the member for Darlington. We've both had excellent communications with our local NHS throughout the entire coronavirus period. Sue and the entire staff from Durham and Darlington NHS Trusts have just been absolutely phenomenal. Whether it's the main hospital in his constituency, or over at University Hospital in North Durham, or down at Bishop Auckland, or at the small community hospitals like Weardale Hospital in my constituency and Shotley Bridge Hospital, which is one of my main campaign issues, just to flag it up to the Minister. We're desperate for them to see renewal. They've seen their amount of beds they've had to use increase from 8 to 16 over the last few weeks to look after those extra patients. So, as Simon Stevens said in evidence to the Public Accounts Committee, one of the things we're going to be looking at in the they want to look at in the long term, is to ensure we do have that capacity within the existing NHS estate for crises when they occur. I'd also like to pay huge tribute to the care homes in my patch, particularly to Shotley Park and to Crescent Home Care in Langley Park, who've been in regular communications with me and to all other of the care providers locally, and also to the pharmacies. On a visit last week to Concert Pharmacy, who just do direct delivery to home, they've seen a 25% increase in the number of people getting those home deliveries, often the most vulnerable in society, who can't go out to and might not have friends and family nearby. So they've been delivering direct to homes, and I think that's been such a lifeline for many people, particularly those with complex conditions, over the last few months. I'd like to give two final shout-outs. One is to some people who weren't mentioned in the member for Newcastle-upon-Tyne's North when she started the debate, which is those carers who are still at home and caring for people in a home setting. My dad's one of those. He's been caring for my grandmother throughout this crisis, and I know a lot of people in my constituency have also had those carers at home, and often having to shield themselves with the person they're caring for. So the sacrifices people have made in incredibly low pay has been phenomenal. And finally, I'd just like to associate myself with the comments of my right honourable friendly member for Peterborough, who said that he hopes that this will let us look towards how we do integrate that health and social care system in the future. And I hope that across the House that's something we'll be working on going forward. Thank you.